Imagine putting your baby to sleep, just like every other night. You tuck them in, turn off the light and whisper, "Sleep well, my love." Now imagine waking up to a silence no parent should ever face. Sudden infant death syndrome, or SIDS, doesn't come with warnings. It doesn't knock. And during the winter months, the risk quietly rises while families believe they're doing everything right. Extra blankets, warmer rooms, closer sleeping. Today's video could save a life, possibly your child's, or someone you love. Before we go any further, please subscribe to this channel, like this video, and share it with every parent or caregiver you know. Leave a comment if you're a parent, a healthcare worker, or someone who wants to protect infants. Your engagement helps spread life-saving knowledge. Sudden infant death syndrome, commonly known as SIDS, remains one of the most devastating and misunderstood causes of infant death. While overall rates have declined due to public health campaigns, SIDS still occurs, and it happens more often in winter. This video is designed for public awareness, not fear. Knowledge empowers parents. Understanding seasonal risks helps families make safer choices, especially during cold months when instinctive behaviors may unintentionally increase danger. Let's begin by understanding what SIDS truly is. What is sudden infant death syndrome? Sudden infant death syndrome is defined as the sudden and unexplained death of an infant under 1 year of age, even after a complete autopsy. A thorough death scene investigation, a detailed review of medical and family history. Because no single cause is found, SIDS is often called a diagnosis. Without a disease, it is not one illness, but rather a tragic outcome resulting from multiple interacting risk factors. SIDS occurs during sleep, typically affects previously healthy infants, most often happens at home, frequently associated with unsafe sleep environments, can occur anywhere an infant sleeps, including sofas, car seats, strollers, or adult beds. SIDS is silent. There is no struggle. No cry. This is why prevention, not detection, is the most powerful tool we have. Why does SIDS appear more often in winter? Decades of research show a clear seasonal pattern. SIDS rates increase during colder months. This does not mean cold air itself kills infants. Instead, winter changes how adults care for babies, and those changes can increase risk. Let's break down the main contributors. Overheating, the hidden winter danger. When temperatures drop, parents naturally want to keep babies warm. But overheating is one of the strongest and most consistent risk factors for SIDS. How overheating happens. Too many clothing layers. Thick blankets or duvets. Heavy sleeping bags combined with blankets. Hats worn indoors or during sleep. Heated rooms throughout the night. Sleeping close to heaters or radiators. Why overheating is dangerous. Thermal stress can reduce an infant's ability to wake up. Impair breathing responses. Affect heart rate regulation. Reduce the baby's ability to respond to low oxygen levels. In simple terms, an overheated baby may not wake up when something goes wrong. Important reassurance. Cool hands and feet are normal. Warmth should be checked at the neck or tummy, not hands or feet. Sweating, flushed cheeks, or feeling hot to the touch are warning signs. Respiratory infections in winter. Winter is also the season of viral illnesses. Research shows many infants who die from SIDS had recent mild respiratory infections. The rise in SIDS mirrors the rise in winter viral infections. Certain ethnic and socioeconomic groups experience both higher infection rates and higher SIDS risk. Even mild infections can alter breathing control, increase inflammation, interact with bacterial toxins, affect oxygen levels during sleep. When infection occurs during a critical developmental window, vulnerability increases. Winter parental behaviors that increase risk. Cold weather changes how families sleep, often unintentionally increasing danger. Common risky practices are bed sharing for warmth, using thick duvets or comforters, sleeping on sofas or armchairs with baby, covering baby's head while sleeping, using hot water bottles or electric blankets, blocking stroller airflow with blankets outdoors. These behaviors are often driven by love and protection, but they can be unsafe. What explains these risks? The triple risk model. The triple risk model is the most accepted explanation for SIDS. It states that SIDS occurs when three factors overlap. Intrinsic vulnerability. Some infants have immature arousal mechanisms. Altered autonomic responses, subtle brainstem abnormalities. Critical developmental period. Most SIDS cases occur between 2 and 4 months. Infant systems are still maturing. External stressor. In winter, these include overheating, unsafe sleep surfaces, respiratory infections, smoke exposure. SIDS occurs only when all three intersect. Does cold temperature itself cause SIDS? No. Research shows that cold air alone does not cause SIDS. Instead, the risk comes from how caregivers respond to cold weather. Neurobiology of SIDS, what research shows about the infant brain. Modern research has moved beyond blaming one cause. Autopsy and neurochemical studies show that many infants who die from SIDS have subtle abnormalities in the brainstem, particularly in areas that control breathing rhythm, heart rate, blood pressure arousal from sleep. Researchers have consistently found altered serotonin signaling in the medulla oblongata, the part of the brain responsible for responding to rising carbon dioxide or falling oxygen levels during sleep. Normally, when oxygen drops or carbon dioxide rises, a baby should take a deeper breath, change position, wake briefly. In vulnerable infants, this protective response may be delayed or absent, especially when combined with external stressors like overheating or infection. This explains why SIDS often occurs silently and without struggle. Sleep position and rebreathing. The oxygen risk, one of the strongest bodies of evidence in SIDS prevention, involves rebreathing of expired air. When an infant sleeps, face down. On soft bedding near pillows, blankets, or adult mattresses, they may rebreathe air they just exhaled. This air contains less oxygen, more carbon dioxide in winter. Thick bedding and bed sharing increase this risk significantly. Back sleeping on a firm surface keeps the airway clear and allows fresh air circulation, which is why the Back to Sleep campaigns reduced SIDS rates by over 50% worldwide. Why soft surfaces are especially dangerous. Research consistently shows that soft sleep surfaces multiply SIDS risk even when babies are placed on their backs. High-risk surfaces include adult mattresses, sofas and armchairs, memory foam, pillows and mattress toppers. These surfaces conform around the baby's face, trap heat, reduce airflow. Sofa sleeping has been shown to carry one of the highest relative risks of sudden infant death, especially when adults fall asleep unintentionally. The role of carbon dioxide retention. Several physiological studies demonstrate that infants sleeping in unsafe environments may experience carbon dioxide retention, especially when overheated, covered by bedding, sleeping prone, or side-lying. In winter, caregivers often add extra blankets, cover the baby's head, block airflow to retain warmth. These well-intentioned actions can lead to a dangerous microenvironment where oxygen levels fall silently. Infection and inflammation, a dangerous interaction. Research suggests that mild infections alone do not cause SIDS, but they can increase vulnerability. Post-mortem studies show elevated inflammatory markers, evidence of immune activation interaction between viral illness and bacterial toxins. Winter infections may alter sleep patterns, increase airway resistance, suppress arousal responses. This is why safe sleep is even more critical when babies have colds or mild fevers, not less. Important reminder for parents: a sick baby does not need extra blankets. Fever is managed by medical advice, not overheating. Prenatal risk factors. What happens before birth matters. Large epidemiological studies show that SIDS risk begins before birth. Prenatal risk factors include smoking during pregnancy, poor prenatal care, maternal anemia, prematurity or low birth weight, exposure to secondhand smoke. These factors may affect brainstem development, autonomic control, arousal mechanisms. This reinforces why SIDS prevention is not about blame. Many risks are biological and invisible. Socioeconomic and environmental evidence. Public health research consistently shows higher SIDS rates in communities facing overcrowded housing, limited heating control, reduced access to safe sleep furniture, inconsistent healthcare access. Winter magnifies these challenges. Evidence shows that providing safe sleep spaces, ribs, bassinets, sleep sack, significantly reduces risk even without changing other factors. This is why community-level prevention matters. Pacifier use, why it works. Pacifier use during sleep has been repeatedly associated with reduced SIDS risk. Proposed mechanisms include maintaining airway patency, altering sleep state, preventing deep, prolonged sleep, improving autonomic stability. Important points for parents: use only for sleep, do not attach to cords or strings, do not reinsert once baby falls asleep, introduce after breastfeeding is established. Immunization and SIDS, addressing a common myth. Extensive research involving millions of infants shows vaccines do not increase SIDS risk. In fact, vaccinated infants have lower rates of SIDS, possibly due to reduced infection burden, improved immune regulation, increased healthcare contact. This is one of the most consistently studied and reassuring findings in pediatric medicine. Over-insulation is more dangerous than cool temperatures. Recommended sleep environment. Ideal room temperature, 16°C to 20°C. Babies do not need hot rooms. Heating all night is usually unnecessary. Recognizing overheating. Parents should look for sweating, damp hair, red or flushed cheeks, rapid breathing, baby feels hot at the chest or neck. If you notice these signs, remove a layer. Lower room temperature, ensure head remains uncovered. Core safe sleep principles. Always place baby on the back supine position for every sleep, night and naps until 1 year of age. This single action dramatically reduces SIDS risk. Use a firm, flat, clear sleep surface, firm mattress, waterproof cover, no pillows, no quilts, no loose blankets, no toys, no mattress toppers. If it's not essential, it doesn't belong in the crib. Room share, not bed share. Baby sleeps in the same room, but on a separate surface. For at least 6 months, room sharing reduces SIDS risk while keeping baby close. Never sleep with baby on a sofa or armchair. This is one of the highest risk situations for infant death. Avoid overheating and head covering. Dress baby lightly. Use fitted sleeping bags. Never cover head during sleep. Dress baby appropriately. Rule of thumb: 1 more layer than an adult would wear. No more. Maintain comfortable room temperature. Babies sleep best in cool, well-ventilated rooms. Encourage breastfeeding. Breastfeeding reduces SIDS risk, supports immune development, provides protection even if partial. Smoke-free environment. No smoking during pregnancy, no smoking around baby, no secondhand smoke exposure. Pacifier use. Offer at sleep time, once breastfeeding is established. Do not force. Pacifiers have been shown to reduce SIDS risk. Additional winter-specific safety tips: remove outdoor clothing indoors, avoid thick or padded bedding, never layer blankets over sleeping bags, avoid weighted blankets. Sick or febrile babies do not need extra layers. Keep crib away from heaters and sunlight. Never use hot water bottles or electric blankets. Ensure stroller airflow is not blocked outdoors. Hospital and system-level prevention strategies. Healthcare systems play a vital role. Model safe sleep in hospital, supine positioning in NICU when stable. Clear sleep surfaces, consistent messaging parents learn by watching. Provide tailored education before discharge. Explain safe sleep verbally. Provide written materials. Confirm understanding. Address cultural practices respectfully. Address social and housing needs. Some families lack safe sleep furniture. Live in crowded housing. Have limited heating control. Healthcare teams should screen early, connect families to resources. Partner with community agencies. Train midwives and health visitors. Assess sleep environments. Reinforce guidance during home visits. Correct unsafe practices compassionately. Key takeaways for healthcare teams and families. SIDS risk increases in winter. Overheating is a major contributor. Respiratory infections add vulnerability. Unsafe warming practices increase danger. Safe sleep principles save lives. Education and modeling matter. Social support reduces risk. Final message to parents and caregivers: if you remember nothing else, remember this: babies sleep safest on their backs, in a clear, firm crib. In a cool room with no loose bedding and no smoke exposure. Winter does not have to be dangerous. Knowledge makes it safe. If this video helped you understand SIDS better, please share it. One share could protect one baby. And that makes all the difference.